Hey everyone, and welcome to today's Explainer. If you've ever sat in a doctor's office, staring at a printout of your lab results and just feeling that knot in your stomach as you look at all those confusing acronyms and red flags, well, you're in exactly the right place. Today, we're going to look at one of the most common tests you will ever take, the complete blood cell count, or CBC for short. Think of me as your personal practitioner walking you through this. We're going to take that intimidating lab report and translate it into plain everyday language. That way, you can walk into your next appointment feeling completely empowered and, most importantly, at ease. Okay, let's dive into this. If you've ever felt anxious about getting a blood test, I want you to think about this staggering number for a second: 1,800. According to our source material from the Mayo Clinic proceedings, that's the approximate number of CBCs ordered every single day at their institution alone. So you are definitely not alone in taking this routine test. It is literally the bedrock of modern medical diagnostics. But here is where the anxiety usually sets in, and I really want to reassure you right out of the gate. Out of those thousands of daily tests, between 10 and 20% of them are actually reported as abnormal. I mean, that is a massive percentage. Seeing an abnormal flag on your chart is incredibly common. Seriously, most of the time it is absolutely not a reason to go down a WebMD panic rabbit hole at 2 in the morning. Today, we're going to break down exactly what that abnormal flag actually means for you and your overall health. Consider this explainer your personal masterclass. Here is our syllabus for today. First, decoding your blood test. Second, meet your blood cells. Third, understanding your baseline. Fourth, when results turn abnormal. And fifth, partnering with your doctor. Section 1. Decoding your blood test. Before we can really understand the numbers themselves, it helps to know what exactly is happening to your blood once it leaves your arm and goes behind the scenes into the laboratory. You see, modern medicine doesn't rely on someone hunched over a microscope counting cells one by one anymore. Instruments, like the culture counter, process your blood electronically. It's actually kind of like a super fast coin sorter. As a blood cell passes through a microscopic opening, it generates a tiny electrical pulse. Each pulse represents one individual cell, and the height of that electrical pulse tells the machine the volume or the size of that specific cell. So this incredible machine is rapidly counting and sizing your circulating blood cells all at once using electricity. Pretty cool, right?
Section 2. Meet your blood cells.
Now that we know how the machine actually counts them, let's take a closer look at what exactly it's counting. Your blood is primarily composed of what we can just call the big three. First up, you have your red blood cells, or RBCs. Think of these as the delivery vehicles carrying oxygen everywhere throughout your body. Second, your white blood cells are WBCs. These are basically the soldiers of your immune system fighting off infections. And third, your platelets, which are the tiny, sticky first responders that help your blood clot and repair tissue whenever you get a cut or a scrape. When you look at your lab report, you're going to see some acronyms that, let's be honest, look like total alphabet soup. Let's demystify one of the most important ones, MCV, or mean corpuscular volume. I know it sounds super intimidating, but because that electronic counter we just talked about measures the pulse height as cells pass through, it actually knows the physical size of your cells. So the MCV is simply the average size of your red blood cells. As we'll see a little later, whether your cells are unusually small or unusually large tells your doctor a great deal about what might be going on in your body. You'll also almost always see hemoglobin, or HGB, and hematocrit, or HCT, on your report. People often get really confused by these two, but from a practical, everyday standpoint, they are basically interchangeable indicators. They essentially give your doctor the exact same information regarding how much of your blood is packed with red cells. If these numbers are low, it generally points to anemia. If they're high, it indicates a condition called polycythemia. Section 3. Understanding your baseline. Okay, this brings us to what is easily the most critical concept of our entire explainer. If you take away nothing else today, please pay close attention to this because it will fundamentally change how you view your medical reports. When the lab prints your results, they provide a reference range right next to your number. Now, this is just a statistical normal based on a huge population of people. But here is the secret. That statistical normal might not be your personal normal. You might display a substantial change from your historic personal baseline without ever actually violating the laboratory's generic reference range. Or conversely, you might naturally sit entirely outside of the lab's reference range, but be perfectly 100% healthy for your own baseline. So the crucial point is, up to 5% of the general population, people without any disease whatsoever, will display laboratory values that fall completely outside the statistically assigned normal reference range. Just let that sink in for a second. You could literally have a red flag on your chart and be in that perfectly healthy 5%. This is exactly why an isolated number on a page shouldn't immediately cause you to panic. Now, what's really interesting about this information is how our baselines naturally differ based on basic demographic factors like sex and race. Take a look at these numbers derived from population-based studies. Generally speaking, red blood cell measurements like hemoglobin are naturally lower and platelet counts are higher in women compared to men. Furthermore, persons of African ancestry often display significantly lower baseline hemoglobin and white blood cell counts compared to white persons. So a low white blood cell count for one person might actually be the absolute perfect, healthy baseline for another, entirely based on their genetics. And that brings us right back to the central thesis from our source material. An abnormal CBC should be interpreted within the context of an individual's baseline value. Because at the end of the day, a number is just a number. It only becomes a diagnosis when your doctor applies the context of who you are, what your history is, and what your normal baseline looks like over time. Section 4. When results turn abnormal. But what happens when a result truly is abnormal for you? Well, doctors don't just guess or immediately assume the worst. They use highly structured, logical flowcharts, like this diagnostic algorithm for microcytic anemia. And this brilliantly illustrates how doctors think. If your red blood cells are abnormally small, they follow a path. They don't just jump straight to extreme conclusions. They start with simple, targeted tests, like checking your serum ferritin levels to see if you simply have an iron deficiency. It's really just a very calculated process of elimination. Let's actually break down that doctor's playbook for anemia as a quick example. First, they classify the anemia by looking at the MCV we talked about earlier, the cell size. Are the cells small, normal, or large? Just this single step massively narrows down the possibilities. Second, they rule out easily treatable causes like simple bleeding, iron deficiency, or maybe a vitamin B12 deficiency. And third, if they need more clues, they will ask the lab to examine a peripheral blood smear. Now, let's see how this exact same logic applies to a completely different issue. This is the logic for thrombocytopenia, which just means a low platelet count. Again, notice the flow. The very first step for the doctor isn't to order some expensive bone marrow biopsy. No way. The first step is to consider if the lab machine just clumped the cells together by accident. Or, hey, maybe the patient is a healthy woman experiencing a completely normal incidental drop in platelets due to pregnancy. They also check for easily fixable causes, like a reaction to everyday medications, such as antibiotics or certain diuretics. Section 5. Partnering with your doctor. So now that you understand how the test works, why your baseline absolutely matters, and how doctors use structured logic to interpret abnormalities, here is your action plan to take control at your next visit. First, start tracking your own historic baseline. Don't just look at today's test, ask how it compares to your test from 3 years ago. Second, keep your own demographic factors in mind. Third, if a result is flagged, ask your doctor to explain their algorithm. Ask them, hey, what treatable causes are we ruling out first? And finally, remember that machines aren't perfect. Our source text strongly recommends using the human eye. If there's a confusing result, don't be afraid to ask if a peripheral blood smear is appropriate so a real human can visually confirm what the machine is reporting. The complete blood cell count is an incredible tool for sure, but it is just the starting point of a conversation between you and your doctor. So I'm going to leave you with this final thought before you head to your next checkup. Instead of panicking over a single new result, have you looked back at your past medical records? Do you actually know your personal baseline? Thank you so much for joining me for today's explainer, and here's to your health and understanding.